Hello everyone. My name's Finola and I'm a midwife here at Oxford University Hospitals, the maternity unit. I regularly cover the elective Caesarean section list. So I'm just going to explain a bit about what to expect when you come in for your Caesarean section. So I'll talk through a few things, and if you have any questions at any point, please feel free to ask as I go along, and I hope you enjoy this video. So first and foremost, you'll get a date for your planned Caesarean section, and then you'll also get given a time. You'll get phoned with a time. You will either get a slot in the morning, which is usually around 7 o'clock. Therefore, you would need to stop eating at 2 o'clock that morning, and you can drink water up until 6 o'clock that morning. If you're coming in the afternoon, which is usually it's actually late morning, so it's from 11 o'clock you would come in. You can eat up until 6 o'clock that morning, so you can have breakfast and you can drink fluids, so water up until 11 o'clock that morning. And so as I said, once you have your date and your time, which you'll be phoned ahead with, you can come in with your with one birth partner. So you would come into our delivery suite and you would be shown to a room. So both you and your birth partner would have the room to yourselves. So we would go through all the pre-op stuff before you actually go through for your Caesarean. So, as I said, you'll be met by a member of staff, you'll be shown into your room. You'll then be also seen by various different members of staff. You're seen by a midwife, so either myself or a couple of other midwives that also cover the elective Caesarean section list. And you'll also see one of our maternity support workers who help out as well. You will have lots of various, it'll be a busy sort of morning or afternoon when you come in. We'll go through lots of different things with you. So as myself, what I would do is come and have a chat with you and your birth partner, come and answer any questions you have that morning. I'd want to have a listen to baby's heartbeat, and we would do your observation, so either myself or the maternity support worker. We would do sort of check your blood pressure, your temperature, your pulse, so the regular observations. So just going to answer a question from hi Holly. So generally you would stay one night. You may well be discharged the following morning once you've seen a doctor from the obstetric team. They would generally need to say they're happy for you to go home, and once you've seen the midwives who have done all your discharge paperwork and your postnatal checks for you and baby. If there are any complications, you may need to stay for 1 or 2 nights, but generally if all goes well, you'd stay one night and go home the following day. So I hope that answers your question. So going back to what happens when you come in that morning, I would also, again, as a midwife, I would give you some pre-theatre medication, which is called omeprazole. So we would obviously check if you have any allergies. The omeprazole is an antacid. It's given to all women routinely before they go into theatre. So we'd give you that, which you can take with some water before you go through to theatre. You would also see an anaesthetist. They would have called you prior to coming in and gone through your pre-op checklist, but they will come in and see you that morning, as you know, to see you face to face, so that they can run through the checklist with you again and just answer any more questions you might have from an anaesthetist side point of view. So they'll talk you through what pain relief they will give you when you go into theatre. You would also see one of our doctors, and they will go through a consent form with you. So they will talk about the procedure itself and check that you're happy to go ahead, and they will get you to sign the consent form once they've taken you through it. So once you've seen them, so the anaesthetist and the doctor, we would also be running through other checks with you. And we would also get, between myself and a maternity support worker, we would get you ready for theatre. So we would get you in a gown, measure you for some TED stockings, which we would put on you before you actually go into theatre. And for your birth partner that would be with you from when you come in that morning or afternoon, we would give them a gown, a hat, and some shoes so that they've got the appropriate things to wear into the theatre. And the room that you're taken into first thing, you can leave all your belongings safely in there, because they will be transferred to the recovery bay, so that when you come out of theatre, all your belongings would be with you still. So just going back to what else we would do, the things we would discuss before you go into theatre in regards to baby is whether you would like to have some skin to skin once the baby's born. This is absolutely 100% possible. We really like to promote this as soon as baby is out. Where our theatres are, our theatre is a bit colder, we always say to bring a hat for baby and a nappy, and we have lots of blankets and things to keep baby warm, so we don't necessarily want to dress the baby, we just want a hat and a nappy. And then once baby is delivered, if you want immediate skin to skin, we would absolutely facilitate this for you. And if you don't quite feel up to it or well enough, we can, if you would like your birth partner to have skin to skin, then we absolutely recommend this. We can also weigh your baby in the theatre as well, so you can see this happening, which is really nice to see. And we offer your baby the vitamin K. This is done through via a one-off injection at birth, or it's offered oral as well. So we know that the vitamin K affects about 1 in 10,000. So it's just something that should have been discussed antenatally with your community midwife, but we would also discuss it again as well. Other things are your method of feeding. You may have done some hand expressing before you come in with the colostrum, and if that's the case, then we can store that. We do have fridge freezer storage, so definitely bring any colostrum you've harvested, bring that in, and we can store that straight away once you come in. That's not a problem. And what we would do as well in the theatre, if it's appropriate and if you're feeling up to it, we can start the baby breastfeeding, especially if you're having skin to skin straight away, as ideally we want them to try and feed within the first hour of them being born. So we would recommend that we try and get them feeding as soon as possible. And if you don't want to breastfeed and you want to bottle feed, then we have that readily available as well. That's not a problem. So just let us know your preferences. And other things we will ask you to have a think about is you can definitely bring, if you want to take pictures in the theatre, that's not a problem as well. Lots of people like to take photos when baby's being born, and that's absolutely fine to do so. So they're the kind of things we would ask you, and I think that's everything. Again, if anyone has any questions in regards to that, please feel free to ask. So just going back to once you're all ready to go into theatre, we would then either myself or one of the theatre team, usually one of the scrub nurses. This is one of the nurses that are in theatre at all times, would come and collect you once you're ready from the room on delivery suite, and would then take you through to the theatre. And then you would usually meet the anaesthetist in the theatre, who you will have seen that morning. So the anaesthetist is the one who will do your pain relief before you have the procedure. So you would be expected to have a cannula put in so that they can give you some fluids and any extra medications, and then they will do your usually a spinal procedure. As I said, they would have spoken to you about this that morning. And then once you're all ready to go, all sort of, nice and numb and feeling comfortable, they would then put a catheter in as well. So one of the scrub nurses would put a catheter in, so that because you won't have the sensation to go for a wee, they will take control of your bladder. So that would be put in before the procedure starts. And then once that's been done, we would then, the other people you might expect to see in theatre is the anaesthetist has an assistant, which they sometimes call like an ODP. They would usually stand at the head end with the anaesthetist and just be helping them out, so assisting them with if they need any medications to give you before the procedure or during the procedure itself. And then there would be 2 or 3 scrub nurses, the surgeon as well. They would only come in, once you're ready, but you will have met them that morning to go through your consent form. And I myself would be in there as well, and we try and keep it to a minimum, only have the people that we necessarily need. So you can expect, if all is sort of to go straight forward, around sort of 5 to 6 people, and the surgeon would also have an assistant, which would be one of our other doctors as well. So you will have the two of them who do the procedure. So once they're ready to start and everything's good to go, you can expect the procedure to take around, from when you go into the theatre to finish, in about 45 minutes to an hour. That's if everything, goes straightforward. Some can be more complex than others, but on an individual basis, and they would talk you through how everything is going during the procedure as well. So once that's done, once baby's out and we've got baby doing skin to skin, and we can weigh the baby and give the baby the vitamin K, and then get feeding going. After all that is done and the procedure's finished, you would then expect to go to our recovery bay, where you would be met by one of our recovery nurses and the maternity support worker who you would have seen that morning. And she will be there to continue supporting you with your feeding. And the recovery nurse will be doing your observations. So they would do these every half an hour for 2 hours, and then they would move on to hourly for 4 hours. So you can expect to stay in our recovery bay for about 6 hours, and they would then get you to try and mobilise, so get you sort of up out of bed once you've had something to eat and drink, and you're starting to feel the sensation in your legs and things. They would be checking your blood loss and just checking your tummy as well. And then, as I said, between sort of 4 to 6 hours after the procedure, so as I said, once you're in the recovery bay, they would want to help you up to mobilise and have a short walk around, just to check how you're feeling and try and get things sort of moving for you again. And if they've got any concerns, we've got doctors readily available if you need to be seen at any point. And once they're happy that you're walking around and you're feeling generally well in yourself, then we would get you to the postnatal ward. So this is where you would go with your baby, and as I said, you would continue to be looked after by the midwives on the postnatal ward and the maternity support workers. And then you would expect to stay for, as I said, one night, if all being straightforward, and then the doctors would come and see you the following morning, just to review how you're feeling, have another feel of your tummy, and check whether you've got any concerns. And then if all is fine, they would generally say if they're happy for you to go home. Once they've said that, it doesn't mean you can go sort of straight home, which lots of women seem to think. It's once the midwife has done your postnatal checks on you and baby, she's happy that the feeding is established and that you're happy with everything, and then they'd get your paperwork together, and you would then more or less be ready to be discharged. So just going back to, I'm just checking if there's anything else I need to cover. So we would also, just going back to once the baby is born, so when the baby's on the scales, we would perform an initial check as well, so where we're counting their fingers, their toes, and just checking that everything's okay. But once you're up on the postnatal ward, your baby would have something called a newborn initial examination, which is normally carried out by some of the midwives that can do this, or one of our neonatal doctors as well, so one of the antenatal practitioners. So as I said, this is something that would be done on the postnatal ward before you are discharged home. So and it's a check that's it's required within 72 hours of your baby being born. So just trying to think of anything else. I think there was a lady who had a few questions. I'm just going to sort of answer those. I don't think she was able to watch, but she's going to sort of look back at the video. So it's just sort of reiterate that your birth partner will stay with you at all times during the procedure. So as I said, once you come in that morning, your birth partner will come in with you and stay in the room with you at all times. Your birth partner will then be taken through to theatre at the same time you're taken through, and they will, as I said, they will stay with you the whole time. And they then, once you're transferred to the recovery bay, they will go with you. They will stay with you, in the recovery bay, and they can stay for 1 hour once you're in the recovery bay. They would then be expected to go home at that point. Now, if your baby needs to go to the special care baby unit, say at delivery, the baby needs to be transferred, then your partner may well be able to go with baby to the special care baby unit, which is what you might want. So you may want, your birth partner to go with baby, and that's absolutely fine. And usually the neonatal doctors, if they're needing to be at delivery, which we would sometimes know before the procedure starts, so we may have the additional people being the baby doctors, we may have them present for delivery. But if all is well, we don't always usually have them there at delivery. It's only if they are needed, or we may well call them just as baby comes out if we've got any concerns. So if your baby goes to special care baby unit, your birth partner should usually be able to go with them, unless the the doctors say otherwise. It may be that they want to get baby settled in there first, and then your partner could then go round to see your baby, and then your partner will be able to come back and join you, so that they can see you for a short while, and obviously check that you're okay before they would be expected to then go home. So just check if there's anything else. If you know you've got a cesarean planned and you happen to go into spontaneous labour, you haven't any contractions at any point, just give the maternity assessment unit a call. They would expect you to anyway, that's fine. And their number would be on the inside of your blue antenatal, your pregnancy notes. So if any worries, any concerns, just give them a call. We always say as well, you would have once the procedure is done, they would normally put a dressing on your over the scar, so over the wound I should say, and this dressing would stay on for 2 days, when it would then be taken off by one of the community midwives. Once this does come off, we say not to put anything on the wound, just to leave it to heal. It's fine to take the arnica tablets. I think one lady did ask that. That's fine, but we'd say don't put anything on it at all. Also, I think I've covered the colostrum as well. That's fine. What else is there? So a lady asked a question in terms of lactation and breast milk sort of coming in. We just refer you to the infant feeding team video, which they've hopefully covered that in regards to your breast milk coming in with a cesarean. Obviously, we expect it's colostrum for the first 3 days, and then your breast milk would come in. But if you sort of require any further information, then just refer to the infant feeding team's Ask the Midwife video. You will also be given routinely a dose of antibiotics in theatre just before the procedure starts, and this is actually to prevent any postnatal infection, so any uterine infection. And because we will be checking your observations so frequently once you've had the procedure, and it would be every 4 hours for the first 24 hours after birth. So as I said, it's half an hour for the first 2 hours, then hourly for 4 hours, and then every 4 hours for those 24 hours that you are staying in. We would always check your temperature and your blood pressure and things. So if we're worried about any infection starting at that point, then we would just get you reviewed by one of our doctors, and they would see whether it's necessary for you to be continued on any antibiotics as well. Trying to think if anyone's got any more questions. I'm hoping hopefully I've covered everything. I think just going to give people a bit more time if they want to ask any questions. Oh, sorry, I've just seen, scrolling down, technical error of the computer. Sorry, apologise. let me just read a few more. So, and again, I'm sorry if I've already said all this. I'm probably going to be a bit repetitive. So Amy says, will I be able to have skin to skin afterwards, as I would like to breastfeed? Also, so I was curious how that would be affected. Yes, absolutely. So you will be with skin to skin. As I said, we definitely promote that once baby's born. As I said, if you're not feeling up to it, some ladies want to have it for a short period of time, and then afterwards we would just, you know, if you want your birth partner to have skin to skin, then we would help facilitate that as well. And another lady, I had a child had an allergy to penicillin, and I'm sure if I'm still allergic, will this be tested again? So the anaesthetist will check this with you to see what you had, whether it was just a rash, but there is other antibiotics that they can give that are not penicillin based. So as I said, the anaesthetist will go through this with you on the morning, so they will check with any allergies and what sort of side effects you've had in the past. So that will be double checked. That's not a problem. Yeah, and also just to refer you to what's really helpful is, which you may have seen in the, thank you Louise for putting this in the video, is the anaesthetic procedure, which that's a really useful video, and it's on YouTube, which is just being put in the comments now. So please have a look at this as well, because that's a really, really good video to look at. Absolutely, Joanne. So they will check with you whether you want to have, they call it a drape sheet. They will check with you whether you want to have that lowered when baby's coming out. And if you don't want to, that's not a problem, but they will check that very last minute just in case you've changed your mind. But that's not a problem. They'll check if you want to do that. Amy, also our birth partners allowed to record a tour from mobile. They can, just as long as you don't get members of staff faces in the video, you know, due to confidentiality. But they can generally take pictures once baby's coming out, or do like a very, very short video, as I said, as long as you don't get people's videos in the in the recording, that's not a problem. Lisa, I've had 2 natural births already and have 2 children, 3 and 18 months, but due twins in 3 weeks. Currently booked in for cesarean, but having second thoughts. What are the risks for a natural birth with twins? Is it safer to have a cesarean section? So, Lisa, this would probably be best to discuss with consultant. I imagine whether you may have already had a consultant appointment. So it's definitely, in regards to sort of the risks and, you know, things, it's definitely best to discuss with consultant before delivery. So if I can sort of refer you to them, they'll be able to answer your question. The catheter would usually, so Joanne, the catheter would usually be taken out the following morning, and once that's taken out, it's usually around 6 in the morning, and then you would normally be expected to provide a urine sample within 4 hours. So that's our sort of new policy, that generally 4 hours we would want you to pass an adequate amount. We just want to check that your bladder's working properly, especially before if you're going to be discharged that day. So Alex, what determines the order at which the planned cesarean sections are carried out? So we normally have 4 ladies each day for their cesarean sections, and it's normally the doctors that make that decision. The morning of, we have a very short meeting to review all the ladies that are in for their planned cesareans, and the doctors will make a decision as to who takes priority in terms of who's more higher risk. And then once we know the order, we will come and let you know, so that we can give you, a rough time, but also let you know whereabouts you are on the list as well, so you know how long roughly you'll be waiting. Will the birth partner be with us throughout the prep process? So yes, as I said, the birth partner will come in with you that morning, so we'll be with you for the when you're being prepped to go to theatre. Yes, they will. Are we expected to isolate before having a cesarean? I believe you are. I know there are some guidance in place that you should be, yes. And this should have been advised by your community midwife. But yes, you are expected to isolate. But if you just clarify with your community midwife how long for before you come into hospital. And you will have also, in regards to COVID, you would have normally had testing before coming in, so we will normally know your result before you come into hospital. Sarah, so just in regards to your comment, unfortunately I can't really comment any further on this at the moment. Obviously because of COVID, it's sort of understandable the guidance that's been put in place, but hopefully there'll be further information soon and we can hopefully see some more positive changes taking place. Claire, how long will we have antibiotics for as standard? Do these affect the baby? No. So as I said, you would routinely have a one-off dose before the cesarean, and as I said, that's just to prevent any infection to your uterus, to your womb. And if you need antibiotics for longer, then you would normally, because the antibiotics are done via your cannula, so they're intravenous. They would, if you require them longer than just one dose, it's normally for a 24-hour period, and then you can, if you need the antibiotics for even longer, you would normally go home on oral antibiotics, which we would give to you at the hospital before you're discharged. No, so the doctors normally take into account if you are breastfeeding, they will normally put you on an antibiotic, as I said, if it's needed, and the one that's safe for breastfeeding as well. So they would always double check with you. And again, they would go through your allergies and things to check that you can take that antibiotic. Emily, can I play my own music? Yes, of course you can. That's another thing. Please bring in music. That's not a problem. So we recommend it if you've got a playlist, bring that into theatre with you. It's quite nice to have that as well. So yes, please do. And see. So Lisa, your question is C-section safer with twins? Again, once you've if you are pregnant with twins, we would normally say speak with your consultant so they can go through the risks and things with you, and to help you sort of choose which mode of delivery you would like to go for. So if you speak with your consultant when you have your appointment with them, if you haven't done so already. And Kelly, are you able to have your birth partner visit for an hour at the weekend, presuming you aren't being discharged that day? So your first question, yes. So if you're not going home that day, there are visiting times in place at the moment on the postnatal ward, and it's probably best that once your birth partner is in the hospital for delivery, double check those times, because sometimes things can change. So, but generally they will be allowed to visit. If you're not going home, they can come and visit, and I believe it's for 1 hour, a 1 hour visiting slot. Yes, so they can come onto the ward. Obviously, if you are being discharged home that day, then no. But someone would, once you're being discharged from the postnatal ward, a member of staff would assist you and baby down to the front door where your partner can meet you with, so that will be fine. And not important really, but what are the rules around wearing a little bit of makeup, having painted nails and surgery? So sometimes people have their toes painted, and that's fine. It's normally fingernails we say to avoid, because with your observations we put a little thing on your finger called a pulse oximetry, so that's to do your check your oxygen levels. So we say if you can avoid having any nail varnish on your hands, that would be great. Emily, in regards to your question, Yes, we always do delayed cord clamping at with the elective cesarean sections. So we always do delayed for around 1 to 2 minutes, and the doctors are really, promoting that as well. They are very good at making, that is a routine thing. The only time we wouldn't do it is if there's a concern with baby, if we're worried about baby's condition once they're born, and we need to give any sort of breathing assistance, then we may want the cord cut and clamped a bit quicker than sort of 1 to 2 minutes. So I'm just scrolling down again. Anna, are we able to elect for a C-section if this is our preference? So unfortunately at our hospital we don't do cesarean sections by request. So if you have any worries around that, then again we just say to speak with your community midwife if there's any other concerns you might have, and they may well refer you to see our consultant midwife or a consultant if it's necessary. So Joanne has just said she's like, isolating for 3 days. So if that's what you've been told, then that's great. Really helpful to know that as well. So so I hope that answers that as well. Holly, hi there, I'm pregnant with MCDA twins and I've been told I'll be having my cesarean section probably by 32 weeks, meaning the babies will have to stay in the NICU. Will I be able to see the babies while I'm recovering? So you will do. So once the babies at 32 weeks, they be transferred to the special care baby unit. Once we've got you sort of up and mobilised, and once you're in the recovery bay, a member of staff will be able to take you round to see your babies as absolutely as soon as possible. And what might help is if your birth partner wants to go around to the special care baby unit when they're allowed and take some pictures of baby. And what's quite nice as well is if you've got something that, say, smells of you, like a blanket or a teddy that you want to put with your baby, so they get that scent. And what's quite nice is if they can take some photos and then bring them back and show you, it really helps with when you're doing some if you're wanting to breastfeed, it really helps with doing some hand expression if you've got something, a picture of the babies or something that sort of smells of them as well. But if you want to hold something close to you during the cesarean section and then put this with your babies once they're born, that's quite a nice thing to do. So it's something worth thinking about. So again, I hope that helps as well. And you're welcome, Emily. Thank you. Kelly, is there an option to have any pain relief medication to take home, or will we just be asked to take paracetamol, ibuprofen? So yes, paracetamol, ibuprofen if you're not allergic to either, but also some ladies may require some hydrocodone, which is codeine based, and if this is the case, then you can be discharged with that medication. Again, they want to check that it's things you can take and it's safe with breastfeeding if you are breastfeeding. But this would be reviewed on the postnatal ward, and it depends on your needs as well. If you need further pain relief, so that will be checked before you are discharged. And Joanne, can the birth partner cut the cord? So unfortunately, because it's all a sterile field once the baby's born, and they try to keep everything as sterile as they can, the birth partner won't be able to come around to where the baby is. So once the drape is dropped, both yourself, if you want to, and your birth partner can have a look over the drape to see baby coming out, but can't touch anything. But once the cord is normally left a little bit longer, so that once it's cut and clamped, once we bring baby round to you, and if you're having skin to skin, then because the cord's normally left a bit longer, we can always get your birth partners to cut it again. That's not a problem because they always leave them quite long. So in a sense they can, but just not initially at delivery. So that they won't miss out, they can definitely cut it at some stage. That's not a problem. So Holly, thank you. If they come at 32 weeks, will they be taken away straight away, or will I get to hold them? So it's really difficult to say. It just depends on their condition at delivery. So I can't really comment much more on that. What they try and do is, if the babies are well and they're stable in the in the theatre, because we do have our resuscitaires in the theatre, so we can give immediate, life breathing support. What the baby doctors will try and do is we will try and get the resuscitaire as close to you as possible. If the baby can't be taken off of the resuscitaire, then they will try and get the babies, as close to you as they can, or your birth partner, because you'll be still having sort of the procedure. Once the babies are out, then they may well, get your birth partner to maybe have a hold of them. It just depends on their condition at birth, so I can't really comment much more. It's very much at the time what's happening. So yeah, sorry, I can't really comment much more on that. Emily, how will they seal the cesarean incision? So they usually use like an absorbent bead. So it's they, sort of once they've finished sort of closing your wound, it will then normally be taken out. There's lots of different ones. They're very individual basis. They do different. So some of them are dissolvable. Some of them will have what they call like a suture bead that is normally taken out 5 days afterwards. So it just depends. They will normally tell you at delivery how they have closed the incision, but they will always put a dressing over afterwards. And this would be checked, very frequently after once you go around to the recovery bay anyway. Isabel, sorry if this has already been asked already, but what is OUH's policy on natural or gentle cesareans? So we've not really been asked much about this. Again, it might be good to have a little look at our intranet and see if there's anything on there at the moment. It's something that I hadn't really been made aware of. So I need to look into this a little bit more, and it's worth actually asking the doctors, because they're the ones that are doing the delivery, to see if they can facilitate more of a sort of natural, gentle cesarean. So yeah, it's worth sort of asking the doctors anyway. Sarah, will the nurses or staff on the ward afterwards be able to help? So I'm really sorry you had a sort of an unfortunate time last time. They definitely will be. So because obviously the partners aren't being allowed on the ward now, where they are for the allocated visiting time, the staff are very much more aware of this, and they're doing everything they can to help, especially with the feeding and most things really. So they are a great team, really supportive, and very aware that you will be it will just be yourself and baby. So they are very supportive, and I hope you have a more positive birth experience this time round. Alex, I've been reading that a postpartum tummy band girdle can help support the incision area. Do you have any thoughts on this? I wasn't sure if it would be a good idea to cover up the wound. So we say not initially. So what it might be worth asking is, if you've already got one, that's fine. I know there's a lot out there regarding the these tummy bands, but it might be worth asking the physios, and they are on the ward, the postnatally, so they will come and see you as well. So it might be worth just checking with them. We say not to put anything on straight away, so especially not in the first sort of couple of days. And we especially say once the dressing's off after 2 days after the birth, just to leave it. We say try not to cover it. Obviously, you've got your clothes on, but we say not to cover it really with anything else. So at some point, it might be that you want to use a tummy band a bit later down the line, but not initially. Rebecca, hi, I've opted for a cesarean section expecting twins. Is there a time that a C-section may not be possible if going into spontaneous labour? So if you do go into spontaneous labour, then you would need to call the maternity assessment unit, and they would review there. One of the doctors would see you, and a decision would be made between them and yourselves to see especially what's the safest for your babies and just for you and your babies. So again, it's a decision really to see. You have to sort of see what's happening at the time if you go into labour before your cesarean section date. I think that's all the questions. So I'll hold on for a little bit longer if there are any more questions. Yeah, fire away. So yes, Claire, you can take arnica tablets. That's absolutely fine. With the Manuka dressings, again, that's not one I'm sure of. I would say avoid putting anything on the wound itself. But arnica tablets are fine with healing, yes. Just going to check that I have covered everything, but yeah, feel free to ask anything else if there isn't something I've covered. So, Emma, so who do you speak to regarding having an elective caesarean section? So you would normally be referred to one of our consultants at the hospital, and they would review, you know, why you need a planned caesarean. So it would normally be through the community midwife, who would then refer you to see one of our consultants at the hospital. Emily, is a breech caesarean any different from a cephalic? So obviously breech meaning baby is its bottom is down, so cephalic is obviously when baby's head is down. So it can be slightly in terms of if you're having a planned caesarean because your baby is breech, then normally the morning you come in you would be scanned by one of our doctors just to check that baby is still in that position, because sometimes babies do turn and do go head down, and if that's the case, then the doctors, once they've scanned you, would have a chat with you after the scan to see you know what you would still like to do, and what they normally sort of recommend as well. So in terms of it being different, again, because baby is in a slightly different position, it's the caesarean is still done exactly the same. They just come out, you know, differently, that's all, in terms of with the bottom rather than their heads. Let me see. Well, so there's not a huge difference though. So Holly, sorry, I missed the start of this chat. What do you recommend we pack to wear after the surgery? So we normally say loose fitting clothes, comfortable clothes. Again, if anything is your any preference that you have. Yeah, so just opt for comfy clothes, definitely. Again, I hope that helps. And also, what's quite good is, you know, the sort of, we do have like netty knickers that you can put on once we've got you up and mobilised. And obviously, I know you'll have your catheter in, but we'll still put some netty knickers on for you with a pad in where we can, you know, monitor your bleeding. But it's good that you have underwear that you know, sort of go over your wound, just so it's not digging into you on your wound itself. So yeah, big pants, Joanne, absolutely, definitely. Couldn't have said it better myself. So yeah, that's definitely the way forward. Let me see, sorry, Claire. Emma, okay, thank you. I'm currently consultant led, so we'll speak to them at my next appointment. We've not, yeah, absolutely, yeah, perfect, that's fine. We've not discussed birth launch, they've just been monitoring me under the perfect. So that's really good that you're being monitored, and yeah, definitely bring this up with them, you know, at your next appointment. Brilliant. Oh, thank you as well. They've obviously just mentioned now in the information about gentle caesareans as well. So yeah, that's really helpful. Thank you for putting that in the comments as well. Yeah, you're all very welcome. Thank you. It's been yeah, great fun doing this video. I hope I've covered everything. Again, if you have any questions, then please don't hesitate to ask us on the morning you come in for your planned caesarean. If you're having a planned caesarean, obviously also ask your community midwife as well. They'll be able to answer your questions during your pregnancy, and that's really great to hear. You're very welcome. And I I think I'll probably, wrap it up for now. I think hopefully I've covered everything, and really look forward to seeing you when you come in for your planned Cesarean. As I said, you'll see either myself or one of the other 2 midwives that also cover the Caesarean section list as well. And any questions, please ask us that morning. We welcome your questions anyway. So thank you very much. I hope you've enjoyed the video. Thank you, and see you all soon. Thank you.